Hello everyone, welcome to this video. Today we are going to talk about swine flu, also known as H1N1 influenza. In this video we'll see origin and history, symptoms and transmission, high risk groups, diagnosis and treatment, prevention and vaccination, India statistics in this virus, H1N1 versus COVID-19, and important MCQs facts also we'll see in this video. So what is swine flu? Swine flu, it is a highly contagious respiratory illness. Okay, it is a contagious respiratory illness and it is caused by influenza type A virus, subtype H1N1. This virus originally comes from pigs or swine before it jumped to humans. So this is this swine flu also known as H1N1 influenza A, and the type of virus is type A influenza virus, and it is in 2009 WHO declared this swine flu as a pandemic, and phase 6 it refers to which is the highest alert level, means this is a very dangerous, and it was originated in pigs and mutated to spread human to human. And this swine flu was first detected in 2009 and it quickly spread to 214 plus countries and territories in 2009. And one important thing to remember, the H1N1 virus is triple resistant virus. What does it mean? This means the genetic material from 3 different sources are in this swine flu. So in this virus, okay, these three genetic materials are in this virus. What are these 3? Swine genes, bird genes and human flu genes. These 3 genes are into this virus, so that's why it called as triple resistant virus. We'll see virus structure and nature. This virus structure and nature we'll see. H1N1 belongs to influenza type A family, the most dangerous influenza type. Here H stands for hemagglutinin. This hemagglutinin is the protein that helps the virus attach itself to the cells, to our cells. The N stands for neuraminidase. It helps virus to release from host cells. And if you see here H1 and N1, we are seeing 1, right? This hemagglutinin, there are 18 types. 18 types of hemagglutinin are there and 7 types of neuraminidase are there. You can understand the possible combinations of influenza viruses. Okay, as I mentioned, the pandemic strain is a triple resistant, meaning it is a genetic mix of swine, avian bird and human influenza virus. Mutation, what is this mutation means? This virus mutates frequently. That means it keeps changing its genetic structure, which makes it difficult to build permanent immunity. Okay, it makes genetic characters keep on changing. It mutate itself, so it is very difficult to get long lasting immunity. Because it can mutate, new strains can be emerged and reinfect previously immune individuals. Okay, the WHO names the pandemic strain is a H1N1 PDM09 2009. So H1 we have seen there are 18 H and 11 N subsystems of influenza A virus. Swine flu gene, avian flu gene and human flu triple resistant origin. This is the history and origin of the swine flu. It's all started in 1918. Spanish flu, H1N1, first known as H1N1 pandemic. It killed almost 50 to 100 million worldwide. This flu was killed almost 50 to 100 million people. In 1976, there was a swine flu outbreak at Fort Dix in the USA. It came among the US soldiers. The government actually launched a mass vaccination program because of this virus. In 1988, okay, first human pig transmission was happened. Now the important year is 2009. Okay, global H1N1 pandemic. This is when H1N1 became the global pandemic. It originated in Mexico. It originated in Mexico and spread rapidly to almost 214 plus countries. And the WHO declared a pandemic on June 11, 2009, phase 6. It indicates highest level of alert. The next India's first case. We'll see the India's first case in Hyderabad on May 13, 2009. So India reported first case of this swine flu. 2015, this is the worst year of India. Almost 42,592 confirmed cases were registered and almost 3,000 people were dead in 2015. This because due to this swine flu, the deadliest H1N1 year for India. The next deadliest is 2017, second worst year for India. Almost 38,811 people got infected with this disease and 2,270 people were died. This recorded across India. And 2019 plus endemic status. H1N1 now classified as in 2019. After 2019, H1N1 classified as endemic, means it is a like a seasonal flu, how it regularly attack, circulates every year globally. This is considered as a endemic status. We'll see what is endemic, what is a pandemic, and what is epidemic. Everything we'll see later. On June 11, 2009, WHO declared H1N1 a global pandemic, the first in 41 years since 1968 Hong Kong flu. After that, this one is a global. WHO declared H1N1 a global pandemic. Almost 214 plus countries get affected. An estimated 1.4 billion people were infected. That's over a billion people. WHO estimates that between 1,05,000 to 3,95,000 people died from this virus, and approximately 20% of the world's population was infected. The case fatality rate, that means the percentage of infected people who died, the percentage of infected people was died is less than 0.2%. That is actually much lower than the COVID-19. And this is a phase 6. Phase 6, that means highest pandemic alert level. And this is the data of H1N1 swine flu in India. Key statistics, if you see, it starts from 2009. This is the first came into in India, and 27,236 people were got affected and 981 deaths, and this is the first wave. So first case registered in Hyderabad, May 13, 2019. This is important. The first case of swine flu was registered in Hyderabad. So next you can see 20,000. Then later it's got reduced. It is 2014 is very less. 2015 was a disaster. Almost 42,592 cases were registered and 2,992, almost 3,000 deaths were happened, and this was India's worst year. And Rajasthan alone 234 deaths. Rajasthan alone had 234 deaths, and the situation was so bad in Ahmedabad that section 144 was imposed in Ahmedabad. And in 2017 was the second worst year with 38,811 cases and 2,270 deaths were reported in this 2017 year. Now let's talk about how swine flu spreads from person to person. There are three main ways: respiratory droplets, direct contact, surface contact. Okay, the first thing we'll see, it is a common way. When an infected person coughs, sneezes, or even just talk, they release tiny droplets into the air that carry this virus. If you are within about 6 feet, okay, up to 6 feet or 2 meters of that person, you can breathe in those droplets and get infected. The second way is through direct contact. Okay, so it is like if you shake hand or hug someone who is infected, then touching your own eyes, nose, or mouth transfers this virus. The third one is surface contact or formities. Okay, so this is the what actually it is. The H1N1 virus can survive on the hard surface like doorknobs, tables, phones for about 2 hours or more than 2 hours. They can survive in these surfaces. Okay, so if you touch a contaminated surface and then touch your face, you can get infected by this virus. These are the common symptoms: high fever, sudden onset, headache, severe muscle pain, body aches, extreme fatigue, sore throat, runny or blocked nose, chills, cough, nausea, vomiting, and diarrhea is less common. So what are the warning signs? Warning signs that seek emergency care. So these are the in emergency situation: difficulty in breathing, shortness of breath, pain or pressure in the chest or abdomen, sudden dizziness or confusion, persistent vomiting, unable to keep fluids down, seizures or neurological symptoms in children, bluish skin, discoloring, and severe or persistent vomiting. These are the warning signs. They need a emergency health care. And the neurological symptoms in children, it is a rare but serious. This symptom is a rare but it is a serious. Seizures, confusion, sudden behavioral changes, altered mental status. Although they are rare, these symptoms can be very severe and even fatal. Let's see who is at risk. The vulnerable groups. These groups are more likely to develop severe complications from H1N1, should seek medical attention early. Okay, who are children under 5 years old. Their immunity systems are still developing, so they are more vulnerable. Next one is adult, 65 plus years. 65 years or above adult. So as we age, our immune system becomes weaker, and many elder people also have other health conditions that that make recovery harder. The third is a pregnant woman. So pregnancy changes the immune system, which makes women more susceptible to the flu. H1N1 can also cause premature births. This disease also cause premature births. Next one is diabetic patients. So high blood sugar weakens the immune system and makes fighting of infections much harder. The next one is heart disease. Flu can trigger cardiac events and worsen existing heart condition. Chronic lung diseases, asthma, COPD patients are at extreme risk. Flu worsens respiratory functions, and kidney diseases and immunocompromised persons also need to take. They are at vulnerable, like HIV, AIDS, cancer patients on chemotherapy. Transplant recipients have reduced defense. They have less immune power. What is the incubation period and contagious and diagnosis? Incubation period means the time from exposure to first symptoms appearing. From after getting infected, from 1 to 4 days, you will notice the changes or symptoms. A person may feel fine, but that person already infected. And contagion window. This infected person can spread virus from 1 day before symptoms to 7+ days after becoming sick. This is a contagious window. That means infected person can spread virus before you notice that virus that into your body. Before that only he can spread this virus from that day to 7+ days after becoming sick. And 2+ hours of surface survival. So they can survive on the surfaces like doorknobs, phones for 2 hours or longer. So if you touch them, you will also get infected with this virus. Diagnosis of H1N1 virus. So RT-PCR test, it is a gold standard. Real-time result transcription PCR, most accurate test. This is the most accurate test. It identifies the viral RNA, and it is a lab-based test, and it took 24 to 48 hours for the result to come. Okay, it is a time taken almost 2 days to complete this to get result. And there is another test, rapid antigen test. It is a quick screening test. It took only 15 to 30 minutes less, but it is a less accurate. Positive result needs, if they get positive, they need to get this RT-PCR test for the confirmation. Next, to viral culture. Grows virus in labs. See, in labs they grow virus. Most definitive but takes days, mainly used for research and surveillance. This viral culture. Throat and nasal swab. Samples collected via throat swab within first 4 days of the illness for the best result. Seasonal flu vaccine does not protect against H1N1 virus. This is important. Seasonal flu vaccines does not protect against H1N1 swine flu. It is the treatment of H1N1 swine flu. The Ministry of Health and Family Welfare in India has divided patients into 3 categories. Category A, Category B and Category C. Category A, mild symptoms, fever, cough, sore throat, no high risk features, home isolation, symptomatic treatments only, no antivirals needed. Category B, high risk patients with mild symptoms or moderate illness. Oseltamivir, it is started immediately. This is an antiviral drug, so hospitalization if needed. And the third category, it is a category 3, so it is a severe illness. This include difficulty in breathing, chest pain, confusion. These patients need immediate hospitalization. Oseltamivir treatment needed for these category people, and possibly ICU is needed for them. These are the antiviral drugs. Oseltamivir, this is the one. Zanamivir and Boloxavir, Marboxil, Peramivir. So these are the antiviral drugs. What is the supportive care? So rest and adequate sleep, high fluid intake, water, ORS, soups, paracetamol, and acetaminophen for fever and pain, cough suppressants as needed. Aspirin prohibited for patients above less than 18 years risk of Ray's syndrome. So aspirin is prohibited for who is less than or equal 18 years of people. So this is another drug for alternative to aspirin. Hospitalized if oxygen saturation falls below 95%. So these are the prevention and precautions, like wash hands regularly, wear a mask, cough, sneeze, adequate, stay home when sick, maintain distance, avoid touching face, get vaccinated, and boost immunity. So these are the some prevention and precautionary steps to follow. Vaccination against H1N1 swine flu. About the H1N1 vaccine. Annual influenza vaccine is the single best way to prevent H1N1 seasonal flu. Vaccine composition is updated every year by WHO based on the circulating strains, because it is mutating frequently. The 2009 H1N1 strain is now included in the annual seasonal influenza vaccine. Recommended vaccine in India 2004. This is a quadrivalent influenza vaccine, QIV. It covers 4 strains. This is a recent recommended vaccine for this swine flu, and a single 15 milligrams dose induces protective immunity in the most adult 12 to 16 years age group. 15 mcg doses required. Vaccine takes 2 weeks to provide full protection. Effectiveness 40 to 60% in matched seasons, reduces hospitalization and death significantly. Live attended intranasal vaccine. This is another vaccine, flu mist, available as an alternative to for eligible age group. This is an alternative vaccine for that. Now we'll see the difference between the swine flu and the COVID-19. This is a virus, influenza Z RNA virus, and for coronavirus it is a coronavirus or COVID-2 RNA virus. Both are RNA viruses. One is influenza A, another one is a coronavirus, and it spreads from pigs, and it is a resultant to humans. This is a spread from bats to humans 2019 in Wuhan, China. And there is an incubation period 1 to 14 days for the swine flu and 2 to 14 days for this COVID-19, average 5 to 6 days. And this is the case fatality rate, less than or equal to 0.2%. But here it is a 1 to 2%, varies by variant, and it is a more. And it how it transmitted through droplets and direct contact. It is droplets and aerosol. So it is a more airborne. Common symptoms: fever, cough, muscle pain, fatigue. Here also fever, cough, loss of loss of taste and smell. Unique symptoms: vomiting, diarrhea common, loss of taste and smell. These are the unique common. These are the unique symptoms in this coronavirus. So vaccine available for both. It is available. Annual influenza vaccine. It is a multiple mRNA and vector vaccines available for this COVID. Treatment: oseltamivir and zanamivir. This is the treatment for this virus of swine flu. And here supportive remdesivir and dexamethasone. So these are the treatments for this COVID-19. WHO status: it is endemic since 2010 and it is a pandemic declared on March 2020. Let's see the difference between epidemic versus pandemic versus endemic. What is epidemic, what is a pandemic, and what is endemic? Okay, here endemic, we'll see endemic. It is a disease that is constantly present in a particular population or a region. So if a disease is common in that particular area or a particular group region, so at a stable expected rate, okay, the rate also expected. So this is known as endemic. Example, H1N1 is now endemic, means we can, this is affecting every time in a particular region with a stable expected rate. Okay, H1N1 is now endemic. It circulates every year as a seasonal flu, and malaria is also one of the endemic, and chickenpox globally. Malaria in India and chickenpox is globally is endemic. The next one is epidemic. What is the meaning of epidemic? A sudden increase in the number of cases of a disease above what is normally expected in a specific area. Like in endemic, we know the expected data, but here it is suddenly the number of cases of this disease is increased than the normal expected data. So example, swine flu in 2015, 42,592 cases were reported. It is a kind of sudden spike, never expected, because the previous year is very low and it is a sudden outbreak. Dengue in Delhi annually during the monsoon. And the third one is pandemic. One example is COVID-19. So an epidemic that spreads across countries and continents, affecting large number of people worldwide. Example, H1N1 swine flu 2009. 214 plus countries were got affected, and COVID-19 in 2020, Spanish flu in 1980. These are the pandemics. They affect worldwide. These are the other viruses, deadly viruses worldwide. Marburg virus. It spreads through fruit bats and it originates in Africa. So named after Marburg, Germany. Hemorrhagic fever, bleeding from mucous membrane and organs. Ebola, it is a Zaire strain. It is spread through fruit bats. It is a host, and where it is originated, Central Africa. There are 5 strains named after African region. Zaire strain are deadliest. This one is a deadliest. Severe hemorrhagic fever. This is the symptoms of this Ebola. The next one is a bird flu, H5N1. Okay, swine flu is a H1N1. Bird flu is H5N1. How it spread? Through poultry, direct contact by poultry, and it is Asia and globally. This origin is present in Asia and global. Highly pathogenic avian. It is avian influenza. Human infected mainly by poultry contact. And the next one is Gesnur forest virus. So this is spread through ticks. They are hot ticks, and it is in Karnataka in India. Discovered in 1955 in southwest coastal India. The symptoms are high fever, headache, muscle pain, and bleeding are the symptoms for this. The next one is the hantavirus. It spread through rodents, and it is originated in Americas and Korea. Named after Hantan River. Named after Hantan River, US soldier infected in Korean War in 1950. It causes lung disease and kidney failure. The next one is Lassa virus. It is spread through multi-mammat rat, and it is originated in West Asia. 15% of rodents in West Asia carry it. Can reoccur in the same region repeatedly. Dengue virus. Dengue virus, how it spread? Aedes mosquito, and it is originated in tropical globally. 50 to 100 million cases per year. 50 to 100 million cases per year. These dengue cases were reported. Major annual threat in India is a mosquito. Major threat in India, mosquito transmitted. Crimean Congo virus. It is spread through ticks, and it is where it is the location Africa and Asia, Europe. It is a viral hemorrhagic fever. Symptoms: fever, muscle pain, vomiting, skin bleeding. And COVID-19, this COVID-19 SARS COVID-2, coronavirus 2, it spread through bats. It is a zoonotic virus, and it is where it is originated China and spread globally. A declared pandemic in March 2020. Novel coronavirus caused the longest modern. It is the longest modern pandemic. These are the some important questions that may be asked in the competitive exam. H1N1 stands for H stands for hemagglutinin type 1. N stands for neuraminidase type 1. First H1N1 case in India in Hyderabad, May 13, 2009, Hyderabad. Answer: the worst year for H1N1, that is 2015, 42,592 cases reported, almost 3,000 people were died. WHO declared 2009 H1N1 pandemic on June 11, 2009, first pandemic in 41 years. Origin country of 2009 H1N1, it is a Mexico, North America. H1N1 virus type, it is a triple resistant, means 3 genes of 3 types are present in this virus, that is swine, avian, human flu genes are present in this virus. Incubation period of H1N1 1 to 4 days, and contagious period, that is from 1 day before symptoms to 7 days after. Drugs of choice for H1N1 treatment: oseltamivir, Tamiflu, neuraminidase. These are the drugs for this H1N1. Countries affected in 2009 pandemic, 214 plus countries were affected by this virus. Okay, let's do a quick revision of everything so far what we have learned. H1N1 is an influenza A virus, a triple resistant made of swine, avian and human flu gene. Okay, this is a swine, avian and human flu gene. It is caused first pandemic of 21st century in 2009. It originated in Mexico and spread 214 plus countries. Now it is endemic, circulates annually as a seasonal flu. These are the key symptoms: fever, cough, sore throat, muscle pain, fatigue, chills, headache, runny nose, vomiting, diarrhea, and neurological symptoms in children. The treatment: oseltamivir. Okay, remember this oseltamivir, it is a treatment for this virus. And alternative: zanamivir, baloxavir, and peramivir. Ministry of Home and Family Welfare categorizes patients into 3 categories. Category A, they are less in danger and they can stay at home and take rest. And then B, they need an antiviral treatment. And C, they need to get hospitalized. And no aspirin for patients under 18 years. Okay, no aspirin is given to the patients under 18 years. If they given, it is turned into Ray's syndrome. The prevention: this is a vaccine. Please remember this vaccine name: quadrivalent influenza vaccine, QIV, quadrivalent influenza vaccine. Handshaking 20 seconds prevention, using mask, social distancing, stay home if symptoms until 24 hours, fever free. So high risk groups: pregnant, elderly, children, and children below 5 years, and diabetic patients. Indian statistics, as we have seen, first case May 13, 2009 in Hyderabad, and worst year 2015 and 2017. And the worst state, Rajasthan is the worst state. It's 2034 deaths were happened in 2015. Global key factor: 2009 pandemic phase 6. Phase 6 means it is a WHO's highest level of alert. Case fatality rate is less than 0.2% versus COVID-19. It is a nearly 2% of fatality rate. Infected: 20% of world's population got infected with this virus, and death 1.05 lakh to 3.95 lakh. This is the estimation of the WHO in 2009. So here we are ending this video. Thank you.